And finally, our antiseptic is actually trying to stands to our course. With this too, I'm not. Hello everyone, my name is Stella Martinez, and for today I am going to perform the proper way of inserting Foley catheter into female patients. So first, what is the purpose of female catheterization? When a patient is having a hard time urinating normally, urinary catheter is usually utilized, and it can also help in performing specific tasks and emptying bladder before or after surgery. So let's get started with the preparation before catheter insertion of my female patient. So first things first, we have to verify the order in order to proceed on identifying our patient and explain to her the procedure that we're going to be using. So all the materials I need are already set, so let's get started. Hello, Mrs. Park. My name is Stella, and I'm going to be the nurse working with you today. So how are you, Mrs. Park? Okay, so I have some questions for you today. May I know your first and last name?
Jera Park.
When is your date of birth?
May 1.
Okay, so do you have any allergies for sulfates?
No.
Okay, great. So, Mrs. Park, I have an order of urinary catheter. So that means I am going to insert a tube inside your urethra, and it's gonna be sitting in your bladder. So it's gonna drain the urine that you have in there, okay? Only will take a couple of minutes, so you don't have to worry. So after that, it is important to ensure the privacy and lighting for our patient, which is already set. So now let's proceed on hand hygiene and wearing our gloves. And so after that, it is time to position our patient in a dorsal recumbent position. So Mrs. Park, let me assist you. Okay. So Mrs. Park, I'm gonna be cleaning your perineal area. So what I'm going to be doing here is I'm going to clean from clitoris to anus, from top to bottom, which is done 3 times, okay? So 1, the side, 2, okay, and 3. Okay. Okay, so let me remove my gloves. And now it is time for draping the patient, so I'm gonna be opening the kit in a clean bedside table. Okay. Okay, so first let's wear our gloves. We're doing hand hygiene first. now, this is straight. We're gonna be placing it here with the shiny side down. So, Mrs. Park, can you raise your hips for me? Okay, great. Okay. Okay. So after that, this is the fenestrated drape to provide more privacy to our patient, which is placed over the perineum. Okay. So this is the 10 cc of sterile water, and it is supposed to be attached to the balloon port. So we're going to be doing that, just really making sure that it is attached very well. Okay? So let me transfer this to first. Insert. Insert. That's right. And finally, our antiseptic solution, which are the cotton balls and sterile forceps. And with these two, I'm not gonna be using. So the materials for catheter insertion are set. So with my non-dominant hand, I am going to place it on the labia and hold this position throughout the procedure. And now I am going to clean the meatus with the antiseptic solution, which is done from top to bottom 3 times. Okay, inside. On the other side. And finally in the middle. Okay. And now it is time for catheter insertion. So, Mrs. Park, can you take some deep breaths for me? Okay, so I am going to insert this until I could see urine and go about 2 more inches. Okay? I'm about to insert it. Okay, great. Okay. Now I could see urine, so let's go about 2 more inches. Okay, you're doing great, Mrs. Park. And now, it is time to insert the water. Slowly. Okay, now let's put it out and check if we're doing it good. Okay, it's good. And for the drainage bag, it is best to place them in an unmovable side of the bed and just below the bladder level. Okay, so we're doing that. And we're good. So Mrs. Park, are we doing great? Okay. Then after the procedure, it is time to clean the used supplies. So I'm gonna be removing this. Okay. Just always be careful. And also the drape, as well as the other things. Then now it is time to remove our gloves and assist our patient into a comfortable position. Okay? Great. So, Mrs. Park, let me assist you. Okay. Then after that, it's finally time for hand hygiene. Okay, so for the documentation, let's put the type and size of catheter and volume. 17. The amount of fluid inserted in the volume. The patient's reaction to the procedure. The amount and characteristics of urine that is observed. The name of the person performing the insertion. The time and date it is completed. And that's it. And that's for my video, and thanks for watching.